All right. Thank you so much for making the time to come and join us on Thursday night. It is 8 o'clock, so we are going to get started, but we're going to give everyone a bit of time to log in because we all know that sometimes technology can trick us, and we're all parents and we've all got kids. And so I'm sure everyone's just going to take a moment to log in. So while we're about to start, let me just tell you a little bit about why we are doing this. I'm a mum, I'm Mimi, I'm a speech pathologist at Talk Shop Speech Pathology in Forestville. I'm a mum of 3 kids, and the last few weeks has been pretty extraordinary and fairly crazy. And I have really struggled with working out how to figure out how to parent, and I've got a lot of questions. We're expats here, so we don't have a support network. So we're trying to figure out, how do I manage my children's health? How do I work? How do I work from home? How do I homeschool? What's the right thing to do? And as much as I look at everything on the news, I can't actually figure out what I can actually do practically to help support my family. As a speech pathologist, I know a lot about learning and literacy, but all these other areas, emotional regulation, how to manage anxiety, how to manage my kids' anxiety, how to manage regressed behaviours, escalations of behaviours, we've had all of that, how to manage the tears, how to manage kids who have not slept in our bed for a really long time, but suddenly they're all back in our beds, all those sorts of things. So let me just show you some of the slides that I prepared for tonight. So we're based on the Northern Beaches. All our presenters are based on Northern Beaches, and we're all families. We're all working and we're all living here on the Northern Beaches. So first up, we've got Dr. Kind, who is going to be talking with us about how to support and manage your families and tips on managing and your family's health during COVID-19. We've got Lisa Aitken, who's a clinical psychologist who is actually studying her PhD in Hope, and she's going to be talking about specifically how to manage anxiety for your family. We've got Amanda Parsons, who is a clinical director at Kids OT, and she's going to be talking about how to manage your kids and perhaps even your own. You might find some helpful tips for you on how to manage escalation of behaviours, sensory processing and emotional regulation. I'll be talking on language that has been really important during this time of coronavirus, and also some literacy tips, because I know that lots of families are really struggling with homeschooling right now. And last but not least, and actually possibly most importantly, we've got Sam Nimmo. So those of you who might be joining us from the homeschooling community will know her very well, because she administers a very large local Facebook group for homeschooling parents. And so as a mum as a speechier who knows a lot about learning and literacy in therapy sessions, suddenly thrown in the deep end with 3 kids at home, trying to figure out how to homeschool, I wanted some shortcuts and actually some advice on how to not make the same mistakes that every parent would probably make at the beginning. And so she's going to do a session on how to hack homeschooling. So I'm hoping that all of these speakers will resonate with you. So as we get started, and as more people are joining us, thank you. I'm just seeing you guys. It would be really lovely if you can just in the Q&A just say, hey, where you're from, how many kids you've got, make any comments. We'd love you to engage with us. So a little bit of housekeeping. In I think your top right-hand corner, or it depends whether you're on Apple or whatever other device, if you just have a little scroll, you should be able to find gallery view. So you can change it from speaker view to gallery view. And if you do that, that means you get to see our slides as well as seeing us, because I think it's a little bit dry to just look at slides and hear someone's voice, and it'd be nice for you to see the speaker live in action. So that's the first thing to point out. And at the bottom, you should be able to see a little button that says Q&A. So we've got a Q&A section, so please just put in your top questions, and you can upvote others as well. So I'm just gonna get back to my slides. Okay, so you may have been having fun during coronavirus and ISO living. This was my own family last night. My kids have been making rainbow jelly, and we've made that over a period of 3 days. So basically we made it in a really giant tub, and we set ourselves a challenge of eating all in one go. We didn't quite manage it, but it does look quite pretty. And then over the next, but what I wanted to say is that despite all these other things that are happening, this doesn't go away. The reality of being a parent at home, you still have grizzly kids, you're still managing that. And then the other things that you're managing is washing. Washing never goes away. That doesn't change. At the very beginning with coronavirus, this is something that I took, a photo I took at our local Coles. I thought it was quite funny, where we had no toilet paper, but we had a whole load of Easter eggs in its place instead. And here's a little throwback, given that it's Thursday. Do you remember the days when there were that many toilet rolls in your local supermarket? So at this point in time, you may be having all these different roles. You may be working from home, you may be homeschooling, you may be trying to maintain social isolation. You're trying to make sure that you're sanitizing your hands and making sure that everyone's staying well and healthy. You're trying to parent, maybe you're looking after elderly relatives, but it's tricky right now. And perhaps you're even struggling with finances. So we're going to try and address many of these types of things over the course of this evening. So again, we've got five speakers for tonight, and then I'm just going to introduce you to Rick right now. So Rick is a doctor who's moved over from the UK. He moved over 18 months ago with his wife and his 2 sons. One of his sons has autism. Over the last few weeks, as you could well imagine, it's been incredibly for him. He's telling me that twice a day he's having updates from the UK and Europe on the changing behaviours and the changing nature on coronavirus, and particularly on how it's affecting children. So I'm going to pass it over to him because he's got a lot to share in the next 15 minutes. Please put your questions in. We'll have 5 minutes of Q&A at the very end of his talk. Thank you so much.
Thanks, Mimi. Thanks. I'm just going to click a couple of buttons so we can get things up and going here. You just have to bear with me a moment there. So you can see my slides just because I've prepared a little something for you just to help along. Okay, all right. And I'm going to try my very best to look at the camera for you guys, but I'm new to all this, so please go easy on me, okay? So like Mimi says, I'm Rick Kine. I'm a GP in Avalon, up on the Northern Beaches. And like all GPs, we've been having to adapt to the new sort of landscape of healthcare really at the moment. So I thought I'd just help you guys out with a few simple things that you might find useful during this difficult time. Something to remember is that, you know, you guys, some of you might have a lot of experience, okay? You might be very knowledgeable about this. I'm going to aim this somewhere in the middle, okay? So please don't feel patronized by things I say. We're just going to go with it, okay? So let me see. All right, so what is COVID-19? Well, look, fundamentally, it's a virus, okay? So viruses are different to bacteria. We don't have particularly any treatments for viruses. Okay, we have a few, but none that we know work against COVID-19 at the moment, okay? This also means that antibiotics aren't effective. Now, that may be obvious to most of you and probably all of you, actually, but in fact, we don't use them and we can't use them. So we don't really have anything going on like that at the moment. They belong to the coronavirus family, which is kind of where it gets its name from. And you've probably had some coronaviruses, okay? There's lots of them out there, okay? It's a family of viruses, and most of them are quite mild, all right? And in most cases, actually, COVID-19 is quite a mild illness, okay? Theoretically, immunity can be achieved by either exposure to the pathogen or vaccination, okay? So unfortunately, vaccination is potentially, look, up to a year away, all right? So we need to think of other things at the moment. It's very infectious, okay? You'll have heard a lot about this, but much more so than the standard seasonal flu, okay? So if you are around it for any length of time, i.e. more than perhaps 15, 20 minutes, you're quite likely to catch it. So that's why this social distancing is so important. And it's spread via droplets in the air, all right? So also by touching people or touching materials and surfaces. And you may have heard various things about lengths of time at which it can exist in certain environments, okay? Really don't pay attention to any of them at the moment. It behaves differently in different temperatures, different humidities. There is no way of telling, okay? Disinfect everything is essentially it, and good hand hygiene. And it can affect anyone, all right? Now, we've noticed that children are less affected perhaps, or remain maybe asymptomatic. They can still be carriers and they can still become unwell, as unfortunately we're seeing emerging things coming out of the UK. But it does tend to be more severe in the over 70s. So we've really got to look after the oldies, okay? Now, what to watch for? I've just put it basic up here. This is what the World Health Organization says to us at the moment. The most common symptoms people are seeing are fever, okay? And I've classified that as someone over 38 degrees C, all right? Some people might argue it's 37.6, 37.8. Go with 38 as a nice clean marker, okay? A cough, it's often dry. It's not a mucousy one particularly. And people are very tired. They get huge amounts of fatigue, which I'm sure you're all feeling at the moment, especially if your mums, dads out there looking after the kids at home. But this is different. This is that sort of fatigue you get with a real illness, the sort that you can't even get up the stairs with, all right? Less commonly, people are noticing things like aches and pains, nasal congestion. Runny noses is also something, sore throat, and diarrhea. Diarrhea is an interesting one. Just today we were having a meeting at the practice. Gastrointestinal system symptoms, were initially thought not really to be part of coronavirus only 2-3 weeks ago. Now we're seeing a lot more of it, and actually, unfortunately, it's becoming quite a poor predictive factor of how people do if they're admitted to hospital with those symptoms. Okay, so be very aware of that. Now, what to do if you experience any symptoms? Look, I'm a GP and I'm going to say talk to them, okay? Telehealth is something we've been given now, all right, and we're all learning to work with it. We've got video conferencing like this. Those of us who are less technologically able are using the phone, which is absolutely fine. We can do so much over that, all right, but give them a call. It's pretty much all bulk billed, okay, because the Medicare has allowed us to do that in this time, all right. But we're going to be able to help you out, whatever questions you've got, hopefully, or at least get back to you. When you call them, your GP is going to ask you some questions, okay, as always. But they're either going to arrange a face-to-face consultation, which we can still do if needed, or testing. Now, testing is something that's happening at different places. Some people are doing it at their practices. Some countries are introducing home testing actually now. We tend to use the official testing centres still, just for safety perspective really, because they have the proper PPE, they're prepared for it. If you speak to your GP in your area, they'll tell you where that is. For us, in Avalon, we're mostly using Mona Vale Hospital, we're using Northern Beaches Hospital, and we're doing a little bit of testing ourselves as well, okay? They may arrange some treatment, okay? Now, I've put antibiotics here, and therefore I've shot myself in the foot, really, because I said antibiotics don't work. Look, they do work in some cases, okay? With a virus, you get a lot of inflammation. That's normally occurring in the lungs, okay, and in the chest. If you get a lot of inflammation, that can attract bacteria and cause what we call a secondary infection, okay? So you can get things like a pneumonia on top of it, in which case we will be using antibiotics to treat that aspect of the illness. We're going to ask the whole household to isolate until that swab result is back, okay? Because potentially you've all had contact and could all be in sort of an incubation period. But these are turning around really fast. We're seeing them within 24 to 36 hours, so it's not long. After testing, the 3 scenarios that are going to arise. One, you're going to be isolating at home with self-care, which is the majority of people. My own sister and mother have both had coronavirus in the UK. Both very mild flu-like illnesses, and they just stayed in their houses 2 weeks, which is a very long time, okay? But in the end, they were okay with self-care. The other one is they're going to make you isolate with treatment, okay? So we're thinking about, like I mentioned, with antibiotics or other treatments. And the third is going to be admit to hospital. If you're particularly unwell with it, we're concerned about some of the signs you're exhibiting, then you're going to need some specialist care, because there definitely is that group that need that. And that is across the board. That isn't just the elderly patients. We've seen people in their 20s, 30s, 40s, 50s end up in intensive care. So it is to be taken seriously. What to keep at home? All right. Now, by all means, you don't have to rush out and get these things. Okay, please don't, in fact. But just consider them if you feel you may need them. Equipment-wise, we're talking about a thermometer is pretty essential, really. You're going to need to know if somebody's got a fever. And when we speak to you on the phone, that's going to be really helpful if you can do part of the examination there, okay? The ones that with the light that you point at the head, perfectly fine. They do get affected a bit by moisture on the skin, things like that, so be aware of that. And if you're getting a reading, try it on someone who's well, just to get a bit of a baseline, all right? The in-the-ear ones, the tympanic ones, are probably better, but then you have to buy the covers as well, so weigh it up. I myself use a light one, so that's fine. An oxygen saturation probe. Now these things are a little clippy thing that your doctor may have put on your finger once or twice. It gives you oxygen levels as a percentage. Okay, that's really helpful for us, particularly in the asthmatic patients or patients with respiratory problems who are going to be at a higher risk of becoming more unwell, all right, with this condition. It's just going to be useful. I'm not saying go out and get one, but if you can have one available or you want to go onto Amazon or somewhere like that and grab one of these, that's absolutely fine. They're actually quite cheap these days and they all work really well. We use sort of about 94% on the oxygen levels if you have one as a cutoff. Anything above that is considered normal. Anything below that, we would need to assess you, okay, and consider some oxygen therapy or admission. And a peak flow meter. Those of you who are asthmatic or have asthmatic children or no asthmatics may have come across these. It's a small tubular device that you blow into, and it essentially gives sort of a crude assessment of your lung function, all right? You need a baseline to compare it to, but again, if you get one of these, your doctor will explain you how to use it over the phone, and they can assess whether or not it's a good reading, okay? It's an excellent measure of how things are going over day to day. Medication-wise, keep some Panadol, all right? Okay, so Panadol is really important for keeping the fever down. Hydrolyte, if you want to rehydrate. You may have heard about Nurofen, ibuprofen. Okay, this started with a French politician a few months ago, suggested that it made coronavirus worse or made you at a higher risk of contracting it. Okay, look, now there's no proof on that yet. Okay, jury's still out. But World Health Organization is recommending we avoid it while we still look into it more, okay? So Panadol first line. And a good supply of your regular medications, inhalers, if already prescribed, especially with the spacer for the children. Okay, I'm going to speed it up a little bit. I'm sorry about this. There's so much to cram in. But how to care for somebody? Well, isolate them. You know all about that. Okay, that's keeping them in a well-ventilated room with minimal contact with other household members. Okay. Hand hygiene, that's a minimum of 40 to 60 seconds soap and water, or 20 to 40 with some alcohol gel. Some cracking songs out there to sing that will get you on the right time. Masks, they're not currently recommended in asymptomatic people who aren't coughing, but certainly in a symptomatic person that's having to move around, it's essential. And there's different degrees of masks as well. You've heard of the P2s, the N95s. They're the best ones with a good tight seal. Keep hydrated. You can see if someone's hydrated by the fact if they're peeing or if their mouth or lips are dry. If either of these things are absent, talk to your doctor, okay? And breathing. Okay, we know COVID-19 has an affinity for the lungs, okay? We need to be careful with people. If you feel that their respiration rate, so how many breaths they take in and out in a minute, is higher than around 18 to 20, they need to be assessed, okay? And if they can speak in full sentences, that's a really good indicator of whether they're getting breathless. Monitor their levels of boredom. They're going to be isolated, they're going to be so bored, and they've got to maintain a positive attitude. That's the only way they'll get better, okay? And it will expedite, okay? So keep entertained, keep motivated, lots of support. Don't ignore mental health problems, okay? My colleague in psychology is, I'm sure, going to talk about this more. But if they're low in mood normally, then this is going to make it potentially even worse, okay? Are they looking withdrawn? Are they anxious? Be alert for these signs. And if you see them, okay, you're going to contact their psychologist or their GP or their psychiatrist and make sure they've got a good supply of their medication. And I mean by that, perhaps like a month's worth at least. And if you're really desperate, out of hours, you've got the mental health line, okay, which is the 1-800 number 011-511. Get some healthy habits going. Listen to the advice. Follow the social distancing, hand hygiene. Keep the alcohol intake low. It's tricky, but we've all got to do our bit. Loads of exercise. We're allowed out for that, don't forget. Keep a routine. Good sleep hygiene is key to that, okay? Go to bed the same time, get up roughly at the same time. This will really keep your head together through this and keep your immune system going, which is so important. Talk to each other and support each other, okay? We're in this for the long haul. This isn't going away in the next few weeks, okay? So just look after each other, and if there's any problems, speak up about it, All right. Lovely to talk to you. I think we're going to have a few questions if you wish.
Thank you so much, Rick, for that presentation. I think I got a lot out of that. You answered a lot of my questions that I had.
No problem.
In terms of what to have at home. I feel like I'm a fairly practical person, but as to what to actually have in the home medical kit and what would be useful, and particularly given that our family has asthma as well, so that's really, really helpful. We don't have any medical questions just yet. Oh, one's just popped up. Yes, okay, so this is one on face masks. What are your thoughts on face masks? And just to add to that, Rick, my own dad WhatsApped me to say, hey, he's got a cloth face mask, he's going to steam iron it.
Yeah, okay.
Dad's not going to thank me for probably mentioning that live, but what are your thoughts on the face masks?
Really good question. Obviously, face masks. One, there's a shortage, okay? So in the hospitals, in the GP practices, we're having to reuse them, okay, which is not good practice. But unfortunately, rationing is something that we've had to get used to, which we're not normally used to living in the developed world, okay? Now, I talked about a few different types. There's the real top quality ones that are going to block everything out, really. They're the N95 masks and the P2 masks, okay? Very hard to come by and much more expensive. The trick is the seal, okay? So it has to be tight and it has to be fitting on your face. Yes, there's the surgical masks that are the sort of the Thai ones, more material based, and there's the ones that everyone's making as well, of course. You know, you've got a lot of people out there doing some good work, making cloth masks, things like that. Now, it's about droplets, isn't it? So if you've got a symptomatic person, they need to be in a mask, okay? Because they are basically shedding coronavirus, okay? If they have coronavirus and they're symptomatic and they're coughing, then you need to stop those droplets getting out. So it's more about stopping it coming out than getting in, okay, with those patients. So they must be in one. Now, currently in Australia and places like the UK, they're not actually recommending them to wear masks if you're what we call asymptomatic, so you're perfectly well, all right? In other countries, they are making it, and in fact, some it's actually law, okay? So you kind of take from that what you will, that an element of that is going to be rationing, okay, that we know we need these masks for high risk settings, okay? So if we're using them out in the community on healthy people, then that's potentially a waste of a mask, okay? But if you can get hold of some or perhaps make some, I would recommend it, because at some point it may come around that they say it is necessary to wear a mask outside. Plus, if you're going to get any kind of illness and you're going to have to go somewhere, you're going to need one, all right? So we've got a bit of a sewing group at the practice that are putting together these masks. You can wash them afterwards, 60 degrees minimum, okay, or boil them, absolutely fine. Some people are using UVC boxes as well, light boxes, things like that. One of our GPs has one. So these are the sort of things you can do. So masks, yeah.
Thanks so much for that, Rick. We've got another two questions which I might get you to answer together. The first one is, does the test hurt? I think the question specifically was, is it like the whooping cough one, which feels right up your nose and is uncomfortable? And then the other question we've got, which is a medical question, is you mentioned that the virus is on materials, and you just mentioned that to wash it at 60 degrees. So it says, the question is, does it attach to clothing? Do you need to wash everything, basically?
Okay. So I'll deal with the swab. The swab, yes. So the pertussis swab, the whooping cough swab, is what we call a nasopharyngeal swab if done properly. It's uncomfortable. I won't say it hurts, all right? Okay, but to be effective, it must be uncomfortable. Essentially, it involves passing the swab onto both sides of both tonsils, okay, which doesn't hurt so much, it's a bit irritating. But then the nasopharyngeal is actually, we have to push that in until you're given a little bit of a wince, okay? And then we're supposed to rotate it around 5 times and take it out, okay? And that is a complete swab, all right? So I'm not going to say it hurts, more uncomfortable. There's a great video on YouTube about how to do it, okay? And that's what we're showing our patients who collect self-swabs. So that's something that we're starting to introduce. The other thing was, your question was about clothes, okay? So yes, it can attach to clothes, can't it? It can attach to any material. Like I mentioned, we don't know how long it exists on things. People have suggested some from hours to days to, I had 9 days today on something. that just suggests to me that we don't really know. Okay, and there's going to be a lot of factors. So if you feel you've been in a high risk area, if you've been in a community, you've been in contact with a lot of people, yes, wash your clothes on a high temperature. We know things don't tend to survive above around 60 degrees. So go for that. All right.
Thanks so much for that, Rick.
Yeah.
We might have some more medical questions come up a bit later. And so can I just remind all the attendees, please do put your questions in that Q&A section just at the bottom. And for anyone who's logged in a little bit later, in the top right hand corner, you should be able to see something called gallery view. Now, if you're on a tablet device, it might not be in the right hand corner, but just have a look around and you can see gallery view, which will allow you to see both the speaker and their slides at the same time, so that it might be a little bit more interactive. Please put your questions in. You will be able to see other people's questions. You can also upvote them as well. So we're going to move over to Lisa now. So Lisa Aitken is a clinical psychologist. She has lived on Northern Beaches all her life. She's been practicing as a clinical psychologist for more than 20 years, and she focuses on individual and family therapy and couple therapy. So she does everything basically. And tonight she's going to be speaking on anxiety, specifically how to manage anxiety, because right now the world has changed so much, and what we thought was normal has completely changed. So I'm just going to hand over to Lisa. Thank you.
Thanks, Mimi. Hi, everyone. It's lovely to be here. So, anxiety. Rick's been talking about how coronavirus is contagious, and I think I would add that anxiety is contagious as well. So, I'm just working out how to do this. There we are. I've got a picture here of these green circles here. Imagine each of those circles is a person in your household. And anxiety tends to bounce around, and especially because we're in lockdown, and we're sort of a bit trapped, aren't we? And it's like the old, year 9 gas in a closed vehicle, that in a closed vesicle, that it's bouncing around. And by anxiety here, I mean garden variety anxiety, not necessarily clinical anxiety. There might be someone in your household who has an anxiety disorder, and they might certainly find that that is worse at the moment. But we're all more anxious, and to be human is to be sometimes anxious. So that's what I want to talk about at the moment. Some of you might have heard this way of explaining anxiety. I really like it. It's a great way. You can even use it for children. So imagine my hand here is my head. And the front of my fingers here is my frontal lobe, this part of my brain, which has all the big picture thinking. And my thumbnail in here is a thing called my amygdala, and it's deep in the back of my brain and of your brain. And it is designed to scan the world for threat. So imagine you're walking down a dark alley, you are alone and you hear footsteps coming up behind you. Your amygdala is going to go off, there's a threat, and it's going to do all the things which you know about. You all know about fight, flight. You all know that your heart is going to pound because you want blood in your major muscle groups. You know that your muscles are going to tense because you're getting ready to run or to fight. And so we know that, for example, aches and pains develop when we're anxious. And a lot of my clients are saying that they're just more achy and more painful, and that's because you're holding this level of anxiety. Your breathing becomes more rapid and shallow because you want oxygen to run or to fight. And often people get chest pains, they feel funny in their chest. Digestion is a low priority for your body. And people get tummy pains. For children, often tummy pains and aches are a sign of anxiety for that reason. But the thing I want to focus on, I'm sure a lot of you know that, what we forget is what is going on in your brain. So when your amygdala gets activated a lot, when you're stressed, when you're under a lot of threat, and we're all feeling a lot of threat at the moment, what happens in your brain is, if you're being chased down a dark alley, that's not the time to think big picture about life. So your frontal lobe, where all that big picture thinking happens, goes offline, is how we put it. And you really are just this raw amygdala facing the world, looking for threat, which is really great if you're being chased down a dark alley, because you're thinking, what if there's more than one person? What if that side alley is a blind alley and I can't escape? And so very helpful to survive. But for those of us where the threat is not physical, I mean, in a sense it is, it's a virus, but for most of us, our struggles and our anxiety is that we're trapped inside with our family and we're trying to juggle work and child minding and the rest of life and not seeing our friends, and the threat is very vague and it's ongoing. And so what's happening in our, for a lot of us in our brains, is our amygdala is very activated. We're noticing all these threats, and it's hard to think big picture. That part of our brain is struggling. So we say to your lids flipped when you're in that, and you might be in a family with a whole lot of people and your raw amygdala is looking at each other feeling threatened. And the challenge is putting your lids back on. The good news is, how many people does it take to calm a system? Let's think about your family as a system, as an emotional system. How many people? The good news is one person can make a difference. So if you're watching this tonight, I would challenge you that you could be that one person just to calm down a bit, because if you calm down a bit, if you're not as reactive, then the whole system can calm down a bit. And if you're a parent and you can stay calm, that makes an absolute world of difference. Easier said than done, I know. So my challenge for you is step outside yourself, observe your patterns. That's what we're going to look at here, and ask yourself that question: who do I want to be? There's so much we cannot control in life. The government is dictating things in a way that we've never had before. Life might feel very chaotic. There's all sorts of behaviours of other people in your family or your friendship circles that you can't control. But who do you want to be in this? How can you best help everyone stay calm? Going to look at some coping strategies. Rick's mentioned a few, and you will have read these. You will have read these on Facebook Messenger groups, on websites. Like, this is nothing new. But use this time as a challenge. Not, do I recognise this, but am I doing this? Have a think about yourself. So the less helpful ones, I'm sorry to say this, we're all baking, I know, we're all eating chocolate to get through this time, but there is a link between sugary food and mental health. For children, for young people, for adults, between anxiety and depression and too much sugar. And we're all consuming quite a lot, much more than normal. So, of course a little bit is fine. Of course a bit is fine. But just beware, if baking is your main strategy, mental health wise, you might need to tone it down a bit. Healthy baking. Excessive alcohol, we know that alcohol sales really spiked. They've eased off. And I've certainly had quite a few clients who said, oh my gosh, I used to just drink on the weekends. Now it's every afternoon. It's my way of coping. The red wine comes out. And of course, again, it's everything in moderation, isn't it? And just notice. I'm sure you know this in theory, but in practice, how are you going? And over focus on the news cycle. Now, we all know that this could increase our anxiety, and for some of us, people are choosing just not to connect too much with the news because they know that it makes them more anxious the more that they read. But I think it can actually do the opposite in a funny way. It can become what we call an anxiety binder. So life at home might be really hard. There's dramas going on with children. You're trying to juggle work. And it's actually easier to read about the drama in France or in Italy or in the United States, or read about Trump and read about the drama over and over and over and keep clicking on the next news item, because it's like an escape. It's a distraction from what's actually going on in your home. And so, it could be not helpful because it's making you more anxious, or you actually could be using it to manage your anxiety. But the problem is the real life is still happening at home and it can become a distraction. So just be aware of that too. And also passively listening to negative self-talk. If you're at home with children, with adolescents who you might be struggling with, work colleagues that, it's been hard because it's all Zoom meetings, you don't get this connection face to face, and you notice it in your head, you've got a few rants going, maybe not so kind about them, or it could be about yourself. I've had quite a few dads of late who say that mum has kept her job, dad might have reduced hours or lost his job, and they've got 3 primary school age children at home, and suddenly dad is having to manage kids at home. It's not a familiar situation. And I've had quite a few men really berate themselves. I'm a terrible dad. I'm a rubbish dad. I don't know what I'm doing. be really careful, because that harsh language to yourself doesn't actually help you cope. It's not going to motivate you to do any better. Rather, trying to be compassionate to yourself. This is a unique time. I can only do what I can do, which leads me over into my helpful section. Do you need to let go of unhelpful thoughts? And ask yourself the question, just because a thought pops in my head doesn't make it useful or true. Is it helpful or is it kind? Breathe, breathe. I always feel like this sounds like such a fluffy, naff thing to say, but it's really important, because I was talking about flipping your lid. Imagine you're running down the dark alley and finally you're in a well-lit street and there's people and you're safe. What is the first thing you're going to do? You're going to breathe. Take a deep, slow breath, and it triggers your body to calm down. Your amygdala stops triggering the release of adrenaline and all of that fight flight. Slow breathing. Set it on your phone. There's lots of apps about breathing and mindfulness, which can be a type of breathing. I'm sure many of you are familiar with Headspace or Smiling Mind, which are fantastic apps about mindfulness and breathing meditations. And they are Headspace even has for children under 5. Both of them have for primary age, adolescent and adults. Really great meditations and strategies, those two websites, Headspace, Smiling Mind and apps. Mindfulness, though, doesn't have to be about breathing. Anything which you just get thoroughly absorbed in, and you just get to get out of your head and into the flow. Weeding, I love weeding personally. We do lots of weeding, knitting, painting, jigsaw, surfing, getting out on the ocean, paddling, anything like that is fantastic. Obviously, we all know about connecting with people and with pets. There's some great research which shows that chatting to your pets calms you down almost to the same extent as chatting to a person. We have a 50-kilo Rhodesian Ridgeback we've been having lots of chats with of late. He's been a great source of support for us. Exercise lowers your cortisol levels, lowers your stress hormone levels. Some of us have been doing masses. Others have really struggled to find the time. But so important, not just for your physical health, for your mental health. A great book, especially on some of the mindfulness and letting go of the unhelpful thoughts, is The Happiness Trap by an Australian Dr. Russ Harris, if you're interested in that. So patterns in relationships while you're trapped at home, just quickly run through a few. Triangles. These form all the time. Triangles are where there's an issue with 2 people and a third person somehow gets involved. But when there's a whole lot of you inside, we're 5 of us in our household. So we've got me and my husband and 3 young adults in various amounts of working at home and working out. And triangles inevitably get a bit intensified. So the challenge here is keep issues between the 2 people where the relationship, where the issue belongs, rather than bringing in a third. So for example, if you find yourself mediating, you have 2 children who are having an argument, and you keep stepping in, and I'm talking about slightly older children here, not tiny ones, and trying to sort of fix it for them, getting involved, or say your partner and a child, then you're actually triangling and you can get in the way of them resolving it. Or aligning, do you find that you align more with one child than another? Or if, let's say, your partner and a child is having a heated discussion, argument, or your partner's trying to help them do their homework, and you find yourself stepping in and supporting one at the expense of another, rather than just leave it between the 2 of them. Or what about focusing on a third? I'm giving a whole lot of homework to couples I'm seeing at the moment to say, go, you might only have 20 minutes, but your project is leave your kids in front of a screen. Everyone's letting their kids, we just have to let them have more screens than normal at the moment, I think, or most people are. 20 minutes, and your challenge is do not talk about your children for 20 minutes and do not talk about COVID for 20 whole minutes. Don't triangle about those other people or that issue. Talk about how are the 2 of you going? How are you finding this? Which brings me to my next point in the separateness, togetherness, balance. Because we've got so much physical togetherness, we're just in each other's presence so much, it's easy to just subconsciously almost balance that out by emotionally distancing, not having deep conversations, not really checking in how are you going. And this could be with your partner, this could be with your children. We're just around each other so much. It can almost feel too intense to have those deeper questions, but it's really important. Physical togetherness is not the same as emotional connection. Lastly, I want to talk about over and under functioning, because again, it's that proximity and that anxiety bouncing around, and it's so easy to be more reactive, which makes us all more anxious. What am I responsible for? What am I in control of? Try and pull the focus back to that question. And what is my child or spouse responsible for? Yeah, I don't know if you can, hopefully you can see the picture of the two dogs there. The idea of over and under functioning is it's a seesaw. So if my child is actually perfectly capable of doing their own homework, and yet I keep stepping in and monitoring and checking, are you procrastinating? Are you doing it? How are you going? Then I'm over functioning. And it actually leads to the child under functioning. So we have to work out, what is my child's functional level? What can they be responsible for? Or this might happen between a couple in terms of chores and housework. Who's responsible for what? Some of us are by nature over-functioners, some under-functioners. The over-functioner is going to have to pull back, the under-functioner pull up. It's a helpful way, I think, of thinking and talking about this. What is my child's level of functioning? So to make sure I'm not over-functioning. I've had recently a client who's in year 12, so she's doing her HSC, and her mother normally lets her do her work by herself pretty much, but because she's home, her mother's hovering, constantly checking, and we had to bring mum into the session and have a bit of a talk about this. My client reported back last time her mum's been able to back off the over functioning, and lo and behold, my client's functioning has lifted, because she was finding she was actually procrastinating more the more her mother monitored. It was actually really hard for her mum to do that. If your child is already anxious, being careful that you're not overly reassuring or enabling too much avoidance. I mean, it's a bit tricky. We're all in this place of sort of avoidance at the moment. But it's easy because we're in each other's presence so much to do too much reassuring. And as parents, letting an anxious child, it's a balancing act, isn't it? You want to do some reassurance, but not letting them, if you do too much, you're actually giving them the message there's something to be anxious about, rather than letting them live with a little bit of anxiety, working out how to do that themselves. The final point really is trying not to focus too much on others, but calming and managing yourself. Two great books on this idea. A lot of these ideas are from a thing called family systems theory, Bowen family systems theory. There's a great book called Growing Yourself Up by Jenny Brown, which talks about these patterns. Ron Rapee has a great book also called Helping Your Anxious Child. So back to the basics, observing your patterns and who do you want to be. If you can try, especially as a parent, to be one calm presence in the household, how are you managing yourself? It will actually help everyone. Thanks.
Thanks so much, Lisa, for that. That was really helpful, and I took away quite a lot of those strategies to reflect on and to think about with my own kids at home, and I'm sure many of our attendees have as well. It doesn't look like we've got any direct questions for you at this moment in time, Lisa, so anyone who's got questions for Lisa, please just pop them in the Q&A down at the bottom, and then at the end perhaps we can swing back around and ask Lisa some of those questions. So on to the next person I'm introducing is Amanda. So Amanda Parsons is Clinical Director at Kids OT in French's Forest. I actually first met Amanda at a school fair where we were both setting up our respective stands, one for speech pathology, one for OT. We both had newborn babies at the same time. We were both trying to figure out how to run the school fair at the same time. So we're just, I'm just going to pass you over to Amanda now, and she's going to be talking about managing emotional regulation, which we all need help with, and management of behaviour management as well. So I'm going to pass over to you right now, Amanda.
Hello, everybody. Good evening. Thanks for making it tonight, because I know there's a lot of pressures and stresses to have to deal with in a day. You guys have all been listening for the last 30 minutes or so to very interesting speakers. And while they're extremely entertaining and have a lot of insightful information, I know that it's really hard to keep your focus. So we're just going to start off with a really quick activity. I don't want you to do this loudly. I understand you've probably got children who you've just put to bed. Or who you certainly don't want to wake up. So just do it really quietly, but all together you can stand up if you feel like you need a little bit of a movement break as well. Yeah, good to stand up and get some blood flowing. Okay, I want to get you guys clapping as fast as you can. So let's clap as fast as I can. Let's go. And now as slow as you can. Slow, 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 fast. Fast as you can, fast as you can, fast as you can. Slow it down and slow, 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 as slow as you can. And fast as you can. Go fast, 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 fast. It doesn't have to be loud. And slow it down. And as slow as you can. All right, hopefully that's reset some focus for you all. And let's move into chatting about some emotional regulation, which I'm sure is needed in a lot of family households right now. And Lisa has also communicated this phenomenon of co-regulation as contagious as well. And I think that's one thing that's really come out of the COVID isolation situation that we're in, that's affecting a lot of families, is emotional regulation is not just about self-regulation. There's a lot of co-regulation concerns in a lot of family households right now. The typical nervous systems are feeling really overwhelmed by all the pressures that we're having to cope with and all of the changes that we're having to face right now. Not to mention a number of individuals around the nation who already have very heightened nervous systems, even prior to and without the COVID-19 crisis. Children and people with ADHD, with autism, with trauma backgrounds, a whole range of different needs and sensory processing disorders, which means that their nervous system's already typically in quite a heightened state. But as I said, typical nervous systems right now are also feeling really overwhelmed. And when it comes to emotional and behavioural regulation in isolation, what we're seeing is a huge increase in the impact of co-regulation in family households rather than just self-regulation. And this is because we're all in it together. We're all living together and having to cope with each other's emotional needs and each other's behaviours. And as stress or anxiety heightens in a family member, it's going to have a direct impact on the nervous system of all people in the household. As Lisa said, it's contagious when it comes to anxiety. It is with heightening your nervous system and feeling stressed as well. The impact of COVID overall has added stresses to many families, as we're well aware of, some with added financial concerns, as Mimi raised, remote learning and dealing with remote learning, multiple children. I'm remote learning for my son in kindergarten, my daughter in year 2. I've got a toddler as well who's 2 years old, and I'm also working. I understand what it's like to have to try to be covering so many bases at once. There's a lot of stress, there's a lot of pressure. There's a lot of changes, and there's a lot of lack of predictability right now. As Lisa also mentioned, there's a lot more screen time, which is going to heighten nervous systems typically. And there's no respite. There's no opportunities just to walk away from it, go to work and be away. So these sorts of images are looking pretty familiar in a lot of families right now. Now, when it comes to the nervous system and our level of arousal and being able to understand it, first of all, we need to understand what's sort of going on in our daily functioning in terms of our arousal states. Now, our arousal states throughout the day are always going to fluctuate. There's going to be moments of stress or frustration or irritability. There's going to be moments where we may have been sitting in a meeting for work and we're sort of feeling on the nod. There's going to be most of our day that we're spending hopefully in a calm, alert state where we're able to focus and attend to learn. And that's in that blue section of our little graph here. Now, in the heightened arousal state, just above that, that's where we're feeling a little frustrated, irritated, stressed, a little bit anxious. And as those emotions and feelings escalate, we hit that line there that we refer to as meltdown or shutdown. And that's when we lose it. We have a tantrum. We have a meltdown about a small little problem. For adults, we might yell at our kids when they've only done something little that we'd usually be able to tolerate. For children, it's when they're over dramatic, they're losing at nothing. We're having a big emotional outburst about something that's not a huge problem. There might be physical sort of aggression, yelling, throwing things, hitting a sister. To a little problem that might have just been that she's taken your toy or knocked over your blocks. We also have, so we have this heightening in during this pandemic of everyone's typical nervous system, because everyone's under the pump and everyone's under stress with a range of different stresses occurring for every different family unit. And once we have one person in the family unit, as Lisa was explaining as well, who's under stress or frustrated and irritated, that's going to have a roll-on effect to everyone else in the family environment, because we're living so closely together. Other people are going to become more anxious, more stressed, and that's going to increase those negative behaviors for them as well. Whereas if we can calm down that cycle a little bit, it gives people more tolerance before they might have an explosion or a meltdown about something that really didn't require such a catastrophic response. The other thing that we're seeing with children at the moment too, and you'll see on the bottom line, low arousal, like I said, that's when we're sort of losing focus. It's difficult to focus and maintain focus. I think of it a bit like when you're going on a long distance drive, and to focus on the road and keep yourself alert and awake, you need to be seeking some sensory input. So you turn the music up or you turn the music down, you chew some gum, you wind the window down, you wind the window up, you do some things to help keep your focus so that you can maintain that focus. Now, when children who need sensory input aren't getting that sensory input, a lot of them are going to crave it, and they're going to be more fidgety than usual. They're going to have to move around a lot. They can't sit still for long because they're craving a lot more sensory input that they're feeling their bodies a little deprived of at the moment, and they know that they need that to feel their normal optimum range to be able to focus and attend, to learn and participate. And under that low arousal, that's when we go off to sleep. So even for a lot of children at the moment and families, when your nervous system's so heightened or you're seeking lots of input, it's really hard to get yourself off to sleep at night. And that's really important, as we heard from Dr. Kind as well. So what we're getting is people who are highly stressed and people who are seeking lots of input for their nervous systems. And while for some, stress and anxiety is high, for others, more often our little people, there's that need to move more and get more sensory input, which they would typically be accessing, but their nervous system is feeling a bit deprived of at the moment. And when there's a seeker in the household, someone who is seeking out some more sensory input to try to keep themselves at what they feel their nervous system is, it's a normal state. If they're seeking a lot, that's sure to escalate anyone who's already in that heightened, stressed state. So that's going to cause more stress in the family units too. So what are we going to do to manage what seems unmanageable in some situations? We know at the moment that we all need to be able to adapt to function across many areas in life. And in being able to support our emotional regulation, we need to understand our arousal state, our own arousal state, and that of others in our house. And there's a great resource that we refer to as the zones of regulation. And there's plenty of information online and plenty of resources that you can utilize in your family home to support the zones of regulation. And what that does is helps us to identify where our nervous system's at any particular time, and where the nervous system of the people closest to us who we're living in isolation with is at any particular time as well. And then we want to apply tools that are going to bring us back to that calm alert state, which we refer to as the green zone. So we've got 4 zones of regulation illustrated, and families will adapt this to reflect their environments as well. So some families add like an orange zone between yellow and red. We have our blue zone where we're tired and bored and sleepy and, you know, going off to sleep or on the nod. We've got our green zone, which is where we want to be most of the time. None of these zones are good or bad. It's just where we need to be to function. And when we're remote learning and trying to remote work at home as well, in the chaos of it all, this is where we want to be to focus, is our green zone, because that's where we can make good choices about our behavior and how we act and react. And it's how we can focus and attend to learn and perform and participate and interact. Then we have a yellow zone where our nervous system is starting to escalate a little into that more heightened zone. So we're feeling a bit frustrated, a bit wiggly, a bit excited, a bit worried, a bit silly, all those sorts of emotions. And then we have our red zone, and that's where we do have that meltdown. We'll get mad, we'll get angry, we might be yelling or hitting. And for some children, they can be quite out of control, for some adults too, right? So we need to apply some tools and some strategies that are going to help bring us back to that green zone. And that's going to include sensory supports, calming techniques, and thinking strategies. So we break things into sensory strategies and cognitive strategies. Now, sensory strategies are things that our sensory system, our body needs. The only way our brain accesses information is from our senses. So we need to utilize those to support our brain and our nervous system. And then we have some thinking strategies where we can apply strategies to help be able to cope with different situations or redirect our behavior. So the really positive thing with this too is these strategies are going to work for people whether they're at home or whether they're back in the classroom and in the work environment. They're also going to be the same strategies that are going to be keeping us calm and our kids calm, are also going to focus their attention. And that's because these strategies help to increase the amount of serotonin, the amount of dopamine that we're able to produce. So our serotonin is going to help regulate our mood and help us feel calmer. And our dopamine is going to help to focus our attention. They're going to counteract that cortisol, those stress hormones, and that adrenaline in terms of balancing that out in the brain as well. So first of all, when we're looking at our sensory supports, we want to consider our physical environment. So making sure that our physical environment when we're home learning and or remote learning and remote working is uncluttered. So it's not providing added stress and added visual issues for us. We need some appropriate lighting. So not too dark and dim where we're feeling sleepy, not too bright that it's annoying for us. We also need to look at things like temperature in the environment. So it's not too hot, that we've got good airflow on hot days, that if it is a bit cold like this evening, that we are warm, so we're not having to deal with those elements as well. And as Dr. Kine mentioned, we need good sleep hygiene, because if we can get a good night's sleep, we can cope with so much more. We need to remove the triggers for people in our households. So understanding the triggers for each person in the house. If you have a child who's a bit oversensitive to the noise of the coffee machine that's going more regularly now, or the blender, perhaps, decide whether that's a really important thing for you, or can you organize to maybe have an instant coffee, or go to the cafe and pick up a coffee instead of putting that machine on if it's going to cause heightening in their nervous system. You may need to have a family meeting to determine triggers for some of the people in your household if they're not so obvious. Make sure you're drinking plenty of water and keeping hydrated, feed hunger. Make sure that you've got postural support so you're not lazing on the couch trying to remote learn on an iPad. And have fidgets available. We're all seeking out sensory fidgets. How many of us are getting up and walking to the pantry and nibbling on things that we wouldn't usually be doing, or opening the fridge door, staring and just walking away? There are all ways of helping to get a sensory break so that we can focus. Use some fidgets instead. And when you need to, obviously, you know, go and get a snack. But create a sensory activity schedule where you can use sensory breaks within part of your remote learning and remote working schedule. And the 5 top ones that we've got, and Lisa mentioned as well, respiration. Respiration is always going to work in helping to calm your nervous system down. If you can calm your breath, you calm your heart rate, you calm your overall activity level. Music less than 60 beats per minute. Having music in the household environment that's less than 60 beats per minute, type it into Spotify, it'll give you a heap of playlists, is going to help keep your nervous system calmer and let you manage things better. Let your kids manage things better. And if you can feel that you're managing and responding to situations in a calmer way, your kids are also going to keep calmer too. Heavy work. Use the opportunity that we have in isolation to get kids out riding bikes, get them helping you with the laundry, carrying the laundry basket. You can do push-ups, planks, sit-ups, anything where you're using muscles and joints, because proprioception is going to help calm the nervous system. Deep pressure, you know, give each other a family massage or use pillow squashes to get some nice deep pressure into the nervous system. And routines and predictability. Any lack of predictability is always going to increase someone's level of anxiety or level of arousal. So keep a schedule of what to expect for the day, a visual schedule if you can. Make sure that you've got sensory breaks. Don't wait for the meltdown to happen. Have those sensory breaks in place so that you're calming the nervous system throughout the day. You can add essential oils. Lavender's known for calming, vetiver to help support focus. So set up your schedule to include heavy work also before main learning blocks, because that's going to help focus attention. So jump on the trampoline or do an obstacle course, and make sure you all have sensory breaks, not just the kids. We as adults need them just as much as the kids. Mimi mentioned that we run our Marshall Methods program at Kids OT, and it's evidence-based to improve regulation, respect and discipline, and core and postural development. Make something like that a family event. We've got free live stream trials and pre-recorded programs you can tap into just by visiting the Marshall Methods website. And there's different fitness organizations have done similar things. So as Lisa and Dr. Kind also mentioned, exercise is really important in helping you to manage your emotional regulation. In terms of cognitive strategies, teaching kids and considering yourself, is it a big problem or is it a little problem? And even asking that question can support a lot of problem solving around conflicts. So you need to match the right response to the size of the problem. So if it's a tiny problem, we shouldn't be having a catastrophic response. So we really need to stop and think, is this a big problem or is this a little problem? And what's the size of the response? Teaching children about flexible thinking. And there's lots of resources online as well. There's a social thinking curriculum where Superflex takes on Rock Brain, and a team of unthinkables like Glass Man who breaks at anything, or Space Invader who's always invading everyone's personal space. And you come up with your own Superflex strategies of how you're going to cope with that. And inner coach versus inner critic. And Lisa also mentioned about negative self-talk and also just the use of inner language. If you look at your to-do list and go, you know what, I'd love to get through this today. That gives a very different mindset to going, oh my God, how am I going to get through that today? So think about what language you're using in your own inner coach and your own inner critic, and teach kids about their inner coach and their inner critic too. There's lots of resources, like I said, online around size of the problem, Superflex and social thinking, Worry Wall, Topic Twister, Was Funny Once, all those characters, how you can go about defeating them by having flexible thinking. And choosing tools like Stop, Think and Choose. Have some tools, tool options that your child can choose. In my household, we have activity cards. They're colored red, green, blue and yellow. So if I see my kids are getting into the yellow zone, they can go and choose a yellow card, and that might tell them to go and jump on the trampoline for 10 minutes and then they can come back and focus. So setting things like that up for your children in your household and for yourself as well. You can use self-regulation meters to help kids to identify what zone they're in, so then they can go and choose the right card as well. And like I said, if you are always in that heightened sort of state as a household, maybe you don't even need the blue zone. Maybe you just start at the green zone and have different shades through to the red zone to help support taught you. Kids love Snapchats. You can use those to give them ideas of what sort of activities they can do to help get themselves back to the green zone. And remember to breathe. There's lots of breathing apps and meditations. Create competitions where you've got to extend the exhale so that kids will take a deep breath in, extend the inhale, and teach them how to breathe with their diaphragm like that. So lots of humming competitions. You can do 6 sides of breathing, lazy 8s, and there's lots of different respiration and meditation apps, as Lisa's mentioned as well, online. I think we're pretty much out of time, so thanks, guys.
So much, Amanda. You covered a lot of ground there. So I'm Mimi. I'm going to talk from a speech pathology perspective. So I'm sure everyone, it's been a long night. We've got 2 more speakers to go. So there's myself and we've got Sam, and we're going to be talking about learning. Now, we're really addressing homeschooling at this period of time. As a speech pathologist, the first thing I'm going to talk to you about is gamification. So gamification, the reason why I think it's really important to talk about gamification is actually because that's what we do all day long in our clinic. So can you imagine that for 5 hours out of our working day, we are actually working with children, working on things that they actually find really hard. Sometimes we're working on speech sounds, sometimes we're working on spelling. These are the kind of things that kids come in and they're like, oh, I don't really want to do this. This is hard for us. And we actually have to get them to practice things that they're not good at. So the way that we do that is through gamification. So I'm actually going to show you some of the things that we do so that you can maybe use those in your own home. So first of all, when kids aren't wanting to do stuff, so I'm just going to take it through from young kids to older kids. What we often do in a therapy session will be to set up, okay, just even a whiteboard or piece of paper and a pen will be fine. Just 3 squares or maybe even 4 squares. Now, generally in a 45-minute session, we're doing at a minimum of 3 activities, sometimes 4, sometimes 5. Just depends on how wiggly the kid is. Now, if we've got 3, then we're just going to get them to cross them off as we do them, because kids don't have a concept of time. If you're having to do homeschooling, it just feels like if something's hard, it's going to feel like it's endless. So if you have like a timetable, you're going to have 3 different things. That's a really good way for them to actually understand that we're going to have 3 things and then we're going to have a break. So you probably have visual timetables. Now for the young kids, having something really small like this where they can tick off or mark off or cross off is actually really, really helpful. We also use timers a lot in our therapy sessions. So we might have 2-minute timers, 5-minute timers. We've got all sorts of timers. And we often do things using our phones as well. Okay, we're going to do this for 2 minutes. We're going to do this for 5 minutes. Now that sounds like high energy. In some ways, actually it is. I'm not going to lie. But we also have ways of us just sitting and making the kids do activities. And so as a parent, especially when you're juggling more than one child at home doing homeschooling, it's a good way to get all the kids involved if you set them at different levels. But having timers is a good way because kids always love to beat the clock, and even more than that, they love to beat adults at something. Let me just show you something to do with routines. Now, I know that Amanda's mentioned the importance of routines, and I think Sam's going to talk a lot more about routines. Now, I think that every household, the routines have changed significantly, and given that term 2 has just started again, and we're not even really sure are kids going back to school, and you possibly have kids going to schools on different days, or maybe you're not even really sure yet. But a visual timetable for the younger kids is really important. So let me show you something that we have had in our household for a couple of years. Now, this is for those of you who really love to go like maybe not high tech, but you know, you want to make it a little bit more specific to your family. So this is something that we've got for one of our kids. Get out of bed. It's actually got a photo there. So it starts off, you start the day, you haven't actually yet done that. And as you go through, get out of bed, make your bed, get dressed, and the reason, and so you can use Velcro dots, that's what we normally use. I've just made up another one, I've got some blue tack, so that's why it's popping back up. Put your pajamas away, eat breakfast, put bowls by sink, crunch and sip. That was for when we were going to school. Recess, lunch, brush teeth, brush hair, spelling. We used to quickly do a little bit of spelling first thing in the morning. Now, the reason why we've got all the little simple things like get out of bed, make bed, get dressed is because actually they're really achievable, and it actually makes kids feel like, yeah, they can do this. And actually when we're doing speech therapy, we always go super low so that kids feel like they can achieve, build confidence before we can move on. So having something like this might be a useful tool in terms of getting set up for the routine and feel like you've actually achieved something, because I think sometimes we forget and we think of all the really hard things that are ahead, but actually we've already done a lot in the day. Now, having something visual, especially for the younger kids, because older kids, you can write and they can cross off, but little kids, having something that's pictorial, and especially if it's got a photograph that's relevant to them and their items and their belongings, might be something they might really enjoy. Okay, so then in terms of reward systems, we in speech therapy often have to do high reps of things. And so I'm thinking of the young kids where you're working on sounds or letters, or if you're working on spelling, those kinds of things where you have to practice quite often. Now, if you imagine in a speech therapy session, we're trying to get 500 repetitions. You're going to say 500 S words. That's actually quite hard work. How are you going to make a child do that? So what we do often is have lots of toys that have got lots of parts. So every time we do 5 or every time we do 4, whatever is achievable, you put one of these in, and this is a pop the pig. So that's an example of one of the ways we do it. Now, if you need to get really high reps on something, we do something like, okay, every time you do 5 of whatever, you get a gold coin. When you get 5 gold coins, you go and do something physical. Now, we always try and get a lot of physical activity happening in our sessions. So we do things like we throw handballs. So we have handball competitions. We have obstacle courses. And just behind me, if you don't know, we have trampolines. So you can see, we get physical, we get moving. And because we know that kids will really, when they're being active, especially because we see lots of kids who are super busy kids, lots of kids who are pre-ADHD diagnosis or have been diagnosed with ADHD, and having movement really helps a child to engage. I am talking fast, I'm sorry, because I've got quite a lot to get through, but just being really active and having reward systems. You don't have to have lots of games and lots of toys like we do here. Over the last month, we've been doing a lot of telehealth sessions. And so what we do is just get sock balls and throw them in your laundry basket. Who hasn't got lots of socks lying around? In our household, we actually have a lost sock box. So we currently have more than 70 single socks. And I'm sure there's a lot more single socks lying around the house. And I don't know why they don't match up, but they just don't. So use your odd socks and throw them in the laundry basket. You can run around the house. You can stick words up and use fly swats just to get active when you're doing that. So that's my segment on gamification. And I hope that gives you some ideas of practical things you can do with those younger kids where there may be more to it, lots of reps on things. Okay. So my next thing that I'm looking to talk to is, well, we just covered a little bit of visual timetables. Here's just another slide for you that has got some pictures. But the other key thing I wanted to talk about is actually the language of emotions for probably about 6 weeks. And yes, we do have many children who come to our service who have autism. Now, transition and change is not something that they find easy. Actually, most of us don't find transition and change easy because we're creatures of habit. But particularly for those kids, it's extra hard. Now, remember, young kids, when we're talking about feelings, we often talk about you feeling happy, you're feeling sad, you might feel angry, you might feel cranky, but actually there are so many more emotions that we feel. But in the moment when you feel those heightened emotions, maybe you don't have the words, and maybe your child doesn't have the words for how they feel. So at all times, one of the things that we've been talking to our families about is talk about how you're feeling. Oh, hey, look at that bird flying in the sky. You know, when I look at birds up flying in the sky, they make me feel just really happy, or make me feel really content. You maybe use other words like satisfied. Here's another range. So on the slide that you should see, we've got other words here: surprised, angry, astonished, embarrassed, confused. There's so many more words to how we feel. And if you are constantly narrating, you're modeling great social language and emotions language, which is not just important for right now, it's actually really important for all of life, for them to be able to express how they feel to you, the parents, to their friends, to be able to navigate friendships and relationships. And you know that, I mean, my experience is that relationship breakdowns is often because we haven't been able to communicate adequately to one another. So giving them language of emotions is actually really, really helpful. And if you're talking about it when they're not stressed in their everyday life, it means that in the moments when they're having big, big feelings, they've actually got some words to pull back on. And having picture cards, I will supply these picture cards too, if you can, and you'll probably find them a useful resource. We've sent heaps of these out to many of our families already. Another thing to do is when you've been talking about emotions is to ask how a child is going each day. I've got an emotions grid, and I think maybe my slides are mixed up, but I have got a slide that shows, hey, how are you feeling today? And so I'm going to, it's probably a little bit later on the end, but I will send it out in the learning, in the resource pack. So how are you feeling today? And I've got a picture of all these different faces, and so you can just reflect on how are you going, not just the child, but how maybe all of you are going. Because right now it's really important to be able to talk and communicate about how you're feeling. Now, the reason why I wanted to put the learning pit up, now, most of you, or many of the public schools in New South Wales have this model, the learning pit. I thought it's really important to put it in because right now, lots of kids just struggling. It may be because actually at home, homeschooling is just trying to log in and trying to find the right piece of information. I can speak from my own experience. At the end of last term, my son who's in year 6 had just such a huge volume of emails that he couldn't even find what he was supposed to do. And in fact, we actually missed a whole lot of work because it was all buried in there. And so it's very easy for all of us to feel like we're in the learning pit, kids and adults, because all of this is quite a challenge. So this is actually quite a nice model of explaining that, yes, you're in the learning pit, it feels really, really hard, but actually this is just a framework and we can get out the learning pit. And part of learning is that it is actually hard, and you will experience success in climbing out of the learning pit. So this is a really great visual. If you want it right now, take a photo of it on your screen before we flick to the next one. You can Google it, there's lots of images. Now, I'm going to talk to families where you've got more than one child. Now, this is something that we train teachers in at school when we are looking at whole class teaching for language. And if you've been following us on Facebook Live in the mornings, we've been doing live book readings, we use this a lot. So click is when you've got your hand out like this, and clunk is this way around. Click means you understand, clunk means you don't. And so this is actually a great strategy for group reading. So this is why we teach it to teachers. So if you've got more than one child, this is a fantastic way that you can teach language to more than one child. So if you're reading a book, I wish I had a book on me right now, but if you're reading a book and you come across a great new word, you go click or clunk. So this is a good way of checking in with, do you understand it or don't you understand it? And there's a good opportunity to discuss it. This is really important because one of the ways kids fall behind or they struggle in classrooms because they're not aware that they don't actually know. So when you actually go click or clunk, this gives them an opportunity to go, hey, click, yeah, do you understand that word? Or clunk. And actually, as speech pathologists, we find that sometimes kids could click. And when you ask them, what does it mean? They've got something similar, but they're not quite on track. So click and clunk is a great way when you've got a new word in a book, and it means that you can read to all 3 of your kids at the same time, and they're getting value out of it. And at the same time, you can do this at the end of a page as well. So click or clunk, did you understand all of that? And they can get click or clunk, and it's just a great way of reflecting on language and learning, and a really good way to read to more than one child. Or you can be more specific and say, was there anything you didn't understand? Okay. So just going to our younger years. Now, I just wanted to share with you some resources. This is something that I really, really love. Now, Letterland has been around for a really, really long time. The reason why I've said it's from preschool to kindy to year 1 is because we know that knowing your sounds and letter correspondence is really, really critical to being able to decode and also to being able to spell. And so often the kids who come to us for literacy intervention are coming because they don't have good recognition or connections between sounds and letters. And so that is why I particularly like this one because it's highly visual. So I've got a couple of cards here. So this is talking test. This is the T sound, the t sound, uppy umbrella, up, and clever cat, k. And these are just really great because oftentimes kids who are struggling with learning letters and sounds, they need something a little bit more visual. So, I mean, you may well have your own resources, but just for those in that age range, if you're struggling, this is a great resource. Okay. So now I'm moving on to talk to the older years. Now, I have had lots of families call us because like all of a sudden, oh my goodness, we've got to deal with this writing and text for school. But actually, we're not really sure how to write because the teachers have set activities and tasks. But what is it that we're supposed to do? So let me just go through this what do we call it, this infographic. Now it looks a little bit complicated, and if you're anything like me, the moment you see a graph you sort of like, oh, shudder. But let me take you through this, because this is what they're teaching in many of the schools in the local area on the Northern Beaches. So first of all, when you're writing a story, teachers talk about a sizzling start. Now I've had parents in therapy sessions going, we've got to write a sizzling start. What is a sizzling start? So stories start with a sizzling start. And then you fill in the information behind it, and then you put like small bits of information, the small problem, the medium problem, you have your tension scene, and then you get your exciting ending. That big action, and then you resolve any issues with the characters. So that's just kind of like the overall pattern. That's what teachers are looking for if your child is having to write a story. Now, many of you in the younger years, between years 2 to 4, you might be given a task to write the beginning, which would be the sizzling start. Those who are writing for the older years 5 to 6, you're really looking at writing the whole narrative. So my last 2 bits is just to talk on what are my top tips for sizzling start, and how do you make the tension scene, because those are the key pieces that you can really develop and push the language. So let me show you how we do that. Okay, we're just going to look at the sizzling start. So this is the sizzling start. That's at the very beginning. And then the next part is where you have the part where you build the tension. That's what I'm going to focus on. Okay, so sizzling starts. And I know that my daughter in year 4 has been given something that she has to write that's got a sizzling start. So a sizzling start, as a parent, so maybe take photos of this in case your child has just already been given some online learning or online tasks that require a sizzling start. This part, include an action or a moment of change. Suddenly something happens. Oh my goodness, this just happened. So you make it really big and dramatic. We use big noisy words. We call them onomatopoeias, but they're like crash, whoosh. Might be something small like plip, plop, plip, plop, plip, plop. Bang, wallop, whoosh. Any of those sorts of noisy sounds, because it grabs attention. So those are the sorts of words that teachers really love. And normally in school, they've got all these words on the board, which is why kids, if they were in the classroom, this kind of thing would be made quite easy. And obviously for you guys as parents, you don't know that that's what teachers are looking for. And your child might not know them, or may not be able to just pull them out of their head. So that's why I want to go through this. Another way to make a sizzling start would be to use dialogue. That's like the quotes or what someone is saying to bring the characters to life. So that's another way to do your sizzling start. Adding humour, or have something to make the reader curious. So like, there was a shadow on the wall, or the shadow slid underneath the doorway. So you're saying something that makes you hook the reader in. And you know that for yourself as a parent. And if you have a really great sizzling start, you might combine a number of these types of things together. Okay, now we're going to move to building the tension scene. Building the tension, if you're writing the whole body of the narrative, you would have written your sizzling start, and then you've got your small pebbles, you've got your medium pebbles, so that's like the small problem, your next bigger problem, your bigger problem, you're really building the tension now. So this is where you want to make things have a bit of a cliffhanger. You might have conflict between characters, so think about who they are, what they might be saying inside the narrative. You might have something where you think the story is going in a particular direction, and suddenly, slam, something unexpected happens. So that creates the tension that teachers are looking for in the text. And then what we do in terms of speech pathology for our children who are struggling with language is we really talk about the senses. So we normally verbalize, we sort of role play this, or we just discuss it verbally. And so this is a really good opportunity for you to ask your child, okay, what are you seeing at this moment in time? Okay, what's happening in the story? What can you see? What are you feeling? What does your skin feel like? What does the air feel like? What do things feel like underneath your feet? What are you hearing? And so when you write those sorts of things, it really elaborates and makes language quite rich. And so as speech pathologists, those are the sorts of the things we're talking with our children about. So I try to condense it as much as possible, but this is really the end of my part, but I hope you found it useful. So just to recap the things I said, the things that I think are most useful are gamification. So if you can make things active and movement-based in the home. For your littlies who are focusing on literacy, I've given you a couple of resources. And for the older kids, I hope that just explaining some of the ways of writing that the teachers are looking for will be helpful for you when you're approaching helping your child with homeschooling. So with me being done. I don't think there's any particular questions for me just at this moment in time. I can't see. Craning my neck and I can't see anything just yet. So I'm going to pass over to Sam. Now, thank you so much everyone for staying with us until this point. Now, we really have left the most critical person till the very end. I have a huge amount of respect for Sam, and she can talk a little bit more about her journey. But Sam has been homeschooling her kids for 9 years. Her oldest is 18 years old. She's got 4 kids. And because actually, whilst I really know how to do therapy with kids one-on-one, the whole concept of trying to homeschool 3 kids. I have 3 kids, 1 in kindy, 1 in year 4, 1 in year 6. Trying to teach them at the same time just blows my mind. So I'm actually going to pass over to Sam now, because she's going to talk about the common pitfalls and some of the strategies that she's found. And one of the things just to say as well, that for the homeschooling community, this is also not normal. I think that we just need to acknowledge that this is not the typical situation even for them. So passing over.
All right, thanks very much, Mimi. So yeah, I definitely want to say, oh wait a minute, I'm just trying to get my slides to work. Yeah, it is all new for all of us. It's an unprecedented situation, and it's new even to experienced home educators, but it's not going to last forever. And you're not expected to do everything. In particular, you don't have to set your child's learning objectives. The teachers will do that. If you feel there's a real mismatch between what's asked of your child and what they can manage, then you can of course communicate with the teachers. You can communicate with the class teachers or the learning support if your child has that. And I would say focus on English and maths overall, and look at the opportunities. With less structured time, more time at home and more flexibility, your children can actually develop a love for learning. You get to spend more time with them, and you get to find out what makes them tick. And in terms of the flexibilities and the opportunities for you and your children, I spoke to several long-term home educators who also work from home. And most of them talked about having a setup where they work in the same room as their children. They spend some focused time with their children, but then they take opportunities. They grab time here and there to get their work done when their children are otherwise occupied. So that's definitely an approach that I would advocate. And finally, play to your strengths. So for example, I love cooking. So I've done a lot of cooking with my children, but if you don't enjoy cooking, then you don't have to. If you're really good at DIY, then get your children involved. My husband knows a lot more about programming than me, so he's been able to teach the kids to program some Lego stuff. It's tough, it's a tough time, but there are also opportunities. Yeah, but what are the obstacles to home learning? Parents are not usually the academic teachers of their own children. And generally children are more comfortable at home, and they will talk back to you in a way that they wouldn't talk to their teachers. So for example, when I started homeschooling my eldest, he's 18 now, and he just turned 9 when I started homeschooling him, I had prepared some maths work for him. I said, okay, this is what we're going to do for maths. And he just looked at it and he said, I'm not going to do that. And he certainly wouldn't have said that to his teachers at school. So the parent-child relationship is generally different to the parent-teacher relationship, and that will be one of the obstacles. But as I said before, I mean, actually you are not their teacher. The teachers are still setting the work for them. So you don't have to, you can use that as a bit of an excuse. You can say, okay, this is what your teacher wants you to do, not what I'm asking you to do. The physical environment, Mans has spoken a little bit about that, and I'm also going to talk about it on one of my slides. But for distractions, we use noise cancelling headphones in home quite a lot. And we also use timers. I know that Mimi talked about using timers. For older children, there's apps on the phones. There's productivity and focus apps that you can use for them. But do be aware that depending on the age and ability and neurology of your child, they may not be able to focus for very long. And I know Amanda mentioned that. So don't set those timers for too long. If your child has problems with executive function, then obviously Mimi's talked about visual schedules already. This picture with the pegs is something that I did for my children. It's another way of making sure that they know what needs to be done, and that they're actually physically noting when they've done it. So it was just a clipboard, and the pegs say the activities that they have to do, and when it's done, they move it onto the other side. And or just write a checklist. For my older, we've stopped using the pegs now, but I just write checklists for my older children now. This is what I want you to get achieved during the day. Your child might have difficulties with transitions. Mimi said about that already. So you don't, it is flexible. This whole time is about flexibility. I think you don't necessarily have to move them on if they're engrossed in something. If it's actually working, then I don't advocate a time-based timetable for homeschooling. We have a list of what to achieve in the day, and the children know what's coming next, but we don't necessarily say this is going to be 20 minutes, this is going to be 30 minutes. If you have, most of us have more than one child in the home, and it can pose its own challenges. So the way I approach it is that we do some activities together. We generally start the day with activities that we do together, but we are sure to have, I make sure I have one-to-one time with each child. If you've got babies, you can make use, babies and toddlers, you can make use of the nap time, you can make use of the breastfeeding time, and you can provide lots of distractions for those babies and toddlers. So I like treasure baskets and heuristic play. You can Google those, and I'll talk a little bit about them later. What if your child refuses to do the work? Well, that may hint at a hidden issue. So you have to try and get to the nitty-gritty of what is actually the reason they're refusing to do this. Is it that they actually don't understand what they're expected to do? Is it that they have, there's a motivation problem, or maybe they're tired, just like Amanda was talking about. Sometimes you can change the work. You can set it in a different way, and your child is able to do it. So there's a little picture on my slide of my child leaping outside. This was maths. This was actually a maths activity. It was measurement. So instead of sitting in the house and measuring objects and going, do you know how long a meter is? Do you know how long 30 centimeters is? We went outside, and I said, how long is your step? When you're walking normally, how far can you step? What if you're leaping? How far can you leap? And so we were doing maths, but we were doing it outside. So sometimes just changing the activity, you're getting to the same learning objective, but you're making it fun for them. And then an idea from one of my homeschooling gurus, Julie Bogart, she says, actually ask your child how much they feel they can manage. How many can you do? And you don't have to do everything in one day. You may want to leave it until tomorrow. Again, if they keep saying, I'm not going to do anything, then there's some hidden problem underneath that. And you can talk to them about it, and you can communicate with their teacher. Because ultimately, it's not actually your responsibility. The teachers still are their teachers. Okay, so move on to the next one. Oh yeah, so recommended times for sustained attention. You can see that it's actually really short for each child. And yeah, so just don't expect too much of them. Be aware of where they are in terms of their age and their stage and their neurology. Physical environment. Most homeschooling families find that their living room and their dining table becomes the hub of activity. Many homeschooling families set up desks in each child's rooms, and they just don't get used. The children migrate to where you are, and that's where everything gets done. And I would say make sure that any materials they need for their schoolwork are easily found. You don't want them to waste half an hour looking for a pencil or a bit of paper. So make sure that everything is there where they can use it. For babies and toddlers, you can provide them with treasure baskets. These are easily made from items that you can find all around the home. And it's just heuristic play. In Greek it means discovery. So basically they're just discovering things, and babies can do this from roughly 6 months old. So Google it. Don't spend $150 buying a treasure basket. You can make one yourself from things that you find in the home. I would say make art and craft materials easily available, but put away anything like wax crayons or textures or paint, because those are actually they need to be used under supervision. So you're looking for items that they can use, they can explore, and they can use without you really being too closely, supervising them. And a wide selection of toys and games. Beads or small toys like the little shop, the stickies, Sylvanian families, Lego minifigures, they're all really good for maths and English. So the characters can act out things, act out plays, they can do stories. You can use them for dividing, you can use them for adding. It's really good to have hands-on things. So that's what I would suggest providing. And whiteboard and whiteboard pens are really good for children who don't like doing handwriting. And I know Amanda talked about this a bit, but you can have fidget cushions, you can sit on your gym balls instead of sitting on a chair. Or if you have a child that really needs to be sitting still for a little while, you can put a weighted lap bag onto their lap to help them to sit still for a little while. You may want to, I'm just going to move this so that on the right hand side of my slide is our term 2 routine. This is what I have devised for my family this term, and you can see it's actually really simple. I've got rough times attached. That doesn't necessarily mean that we're going to get the stuff done. At the moment, I'm only homeschooling my 8-year-old and my 11-year-old. But exercise, everybody said the same thing. It's so important. Getting exercise done in the morning as well, it's going to help your children to concentrate and to focus on their work. And then what we do is we make sure we start the day with time together as a family. So we start with morning time, and I say to them, okay, what are you thankful for today? What are your concerns? And what are your goals for today? So usually each of us, I join in as well, we have 3 things we're thankful for, 1 thing we're concerned about, and then we have what our goal is for the day. And then I read a story to them together. Then while my 11-year-old goes off and works on things independently, I will have what I call special time, and I'll work with my 8-year-old, and I'll do reading, writing, spelling and maths with her, no more than 10 minutes of each of those. And sometimes we might just choose one, and that would be enough for the day. Then we have a fruit break. Then I'll work with my 11-year-old. That will be a lot more focused on the important thing that they're doing that day. I would say during this time, you've probably got used to how your children behave when they're stuck at home with the rest of the family. You can observe them and find out when are they actually most open to learning with you. I think in the morning after exercise is usually really good. Definitely having regular breaks for food. But when I was homeschooling 3 children and I was also homeschooling the older child, then I would expect them to be more self-directed. So they'd join in with morning time, and then they would go through their own checklist. They would come to me if they had problems, and then I would check in with them at the end of the day, probably when the other kids were asleep, to make sure that they'd got their work done and I knew how it was all going. How can you help your child? So assuming you've set up everything, assuming you've set up the environment, you've done lots of physical activity, you've got this flexible schedule worked out, and you're working one-to-one with one of your children. They may still have problems. They may have problems actually starting the tasks, actually getting anything done. They may have problems understanding the tasks. They may have problems completing them and handing them in. So when you're doing that really important one-to-one time, stay with your child, help them understand what they're required to do. And like I said before, you can change the task if necessary. I really think it's important to have hands-on physical activities. So I often change the tasks. We use beads, we use shaving foam with dye to do spelling. And sometimes everything is just too overwhelming, and you just need to choose just one thing. So especially we're all working at the same time as living in the house with more people than we're used to. It's okay to say, right, I can't get everything done that the school has sent. I just can't get through all of it. I'm going to choose the most important thing. What is the most important thing that my child needs help with at the moment? And then communicate with the child. So unsupervised activities. So this is for times when you really need to focus on your work. So if you're doing phone calls or if you're doing Zoom calls, you don't want the kids to be disturbing you. So save the fun activities, not the tough stuff. Save the fun activities for them. And I would say for younger children, you could set aside a special box of things that they only can do when mummy is working or when daddy is working. And don't worry that they're not learning. Learning is still happening. There's so many different things that they can do. They're still learning. They can do art and craft. They can do Lego challenges. There's so many live streams being put up and YouTube channels that they can watch. There's DVD. My daughter loves watching Horrible Histories DVDs. There's a whole load of things on ABC that they can watch. I've put some ideas for learning apps, and tentatively I would say they could play board and card games together. But I have found when I'm working, when I have to do a tutorial and I say, right, I'm doing a tutorial, I need you to get this done. If I leave them playing a game together, then often I have to pause and go and intervene. So that I very tentatively suggest that. I've put some photos of blocks because if you have toys that aren't really targeted at a particular thing, then the children can actually do, Mimi talked about the deep learning. This unsupervised time, this unstructured time can actually really help your children to discover what they're interested in. Blocks can become everything. They can become a city, they can become a maze, they could become a throne for Teddy, or you know, it's not just for playing Jenga. And also your children, my children certainly in over Easter, I found they were actually reading books a lot more than usual. They actually had time just to read. So don't worry too much that this unsupervised time while you're trying to get your work done, that they're not learning, because they actually are. They're just able to spend a bit of time pursuing things that they're actually interested in. And I think that's it really. I've got a whole load of resources there. I've probably missed something that I thought I was going to say, but there we go. Mimi, I'll hand back to you.
Thank you so much, Sam. So much gold in that. I think it was also really reassuring just to know that it doesn't all have to be structured. I took a couple, I mean, I know I have access to the slides, but even so, I took a couple of photos of how you've set up your timetable for this term. And also, and I thought it's really interesting, the thing that you set up showed about attention and how long they can attend. That resonates with what I see clinically. You know, you said that for the really little kids it's 4 to 5 minutes, which is why we're regularly changing activities, but it's a reminder that actually sometimes perhaps we might be expecting too much. So really, really reassuring. And thank you so much for your really comprehensive resource list. Now I'm just going to lean over for a second because I see another question just popped up and I can't even see it. Okay, so Nikki has asked if you can have the resource slide again. So I'll just wrap this up and we'll pop it back on at the very end, and then people can take photographs. We will distribute this. Anyone who's registered, we will be putting all this information together as soon as we can. But I'll pop the slide back on in just a second. One last thing I wanted to say was, back in my own presentation, I'd wanted to do a little segment on another time, but I know that many families are struggling at home because all of a sudden you're seeing how your child learns, and sometimes families are saying, oh my gosh, I knew that my child may be struggling, but I didn't realize I was really struggling like this. So we've got some really good strategies that we use in literacy therapy, and I wanted to do a demonstration, but what I will do is that probably not tomorrow, tomorrow's Friday, but over the weekend and by Monday, I will do a video on spelling strategies that we use day in, day out, which are really, really useful and really fast, fail-safe, really great ways to get your kids on track with spelling. Now, obviously, if there's more to it, we might need to do some extra, but that's what I had wanted to cover for today, because I know that lots of families are struggling with literacy in terms of reading and writing and decoding and spelling and all those sorts of things. And I know that if you can't spell, you spend a lot of time trying to figure out how you're spelling that, and you lost the meaning, you don't finish your sentences, or your sentences are shorter because you're actually avoiding words. So actually spelling itself can be quite a tricky issue and can cause other issues as well. But as we're wrapping up, I'm just looking around, and I just want to say a huge, huge thank you to all of our speakers tonight. Every person has given of their own time for free. We're all family people here. We all live, and as I said, we all live and we all work on the Northern Beaches, and we wanted to share this together because actually we all had something that we wanted to give, and we thought that collectively it might answer some of the questions that people in the community had. Certainly I had a lot of questions, and I feel like many of them have been answered tonight. I know that actually one question had come up about sleep, and I just wanted to ask Rick that question, Dr. Kind that question. So if we just flip over to Dr. Kind, oh, we weren't quite ready, sorry about that. So we might just get him to answer that question a little bit later. We just had a question about sleep. So any other questions that we haven't been able to answer in through this night, we will take a note of it and we will answer separately as part of our lockdown living rescue pack. So I think we're just gonna finalize for tonight. I'm just looking around for confirmation just to say we're ready to wrap up. Doesn't look like there's any major questions that we could answer right now. I will flip back to that last slide. So thank you everyone. Looks like it's already up. Thank you everyone for staying with us. And thank you for participating and asking your questions tonight. I hope you found it useful and you've just got small pieces of useful gold that you can use within your family so that we can all get through this really strange and crazy time together better, because if we can not just survive but thrive, that would just be such a much better outcome. That's what we're looking for from all of us as the speakers tonight. Thank you so much.